Hello, my name is Debono and I'm a PhD student here at the University of Queensland within the Venom Evolution Laboratory. Have you ever cut yourself and noticed that it stopped bleeding after a couple of minutes or even a couple of seconds if you've applied the correct pressure? Well, what happens is our bodies are designed to stop ourselves from excessive bleeding or bleeding out. And what's been put in place is what's called a coagulation cascade. And that cascade is either triggered internally or externally by impact or injury. And it's a set of factors that are already existing within our bloodstream. And what they do, they trigger one and then the next one in a cascade formation until we get to a nice clot, which is what prevents us from bleeding out. And that's what happens when we cut ourselves. That clot forms. Unfortunately, there are individuals within our population that have trouble doing this. There's two forms. They either bleed too much and they can't stop themselves from bleeding, or they clot too often, so they have lots of clots within their blood. And unfortunately, that's due to particular parts on that coagulation cascade where the factors or those steps within the cascade aren't working as they should. My PhD research focuses on counteracting these activities by looking at novel drug design and development therapeutic or leads from the environment. And I look at snake venom, and in particular snake species from Asia and Africa that have these activities. They either promote the blood to clot or they prevent that blood from clotting. And what I do, I investigate their venom as a whole, and I have a look at what's in the venom, what's in this cocktail mixture, and I have a look at the proteins that are actually affecting particular parts of that cascade. So we know that these venoms are either procoagulant, promoting that blood clot, or anticoagulant, preventing that blood clot from occurring. And what I do, I investigate those proteins within that venom, and I have a look at where they hit on the cascade, how we can use those activities for potential therapeutic drug design and development. Some examples are already on the market. There's one drug design called Arvin, and Arvin actually is a preventative stroke medication. And that is a prime example that we can use snake venom proteins as a novel drug design and development for such blood clotting disorders. So that's my research on snake venom from blood to drugs development.